Dr. Christy Ennis, here to show you some exercises to make your arthritic knees and hips feel better. To help show you the best 5 seated exercises, I'm joined today by a special guest.
My name's Alyssa. I'm a doctor of physical therapy and specialize in helping people specifically with osteoarthritis. Movement and strengthening can be incredibly powerful in helping you find pain relief from hip or knee arthritis. I am here to help show you these 5 seated exercises. If you want to catch the 5 standing exercises, you can head on over to my channel by searching Arthritis Adventure. Let's get started.
Our first exercise is going to work on that bending or knee flexion. I'm going to lie right on down, and you can do this right in bed. You do not have to get onto the floor. You're going to take a hand towel or whatever towel small that you have, place it behind the knee, and what this is doing is going to help gap that knee joint or open up that knee joint so there's a little bit more space so you can get a little bit more range of motion. So a towel's in there. I'm going to let that leg come down. If that's all that leg wants to go, totally fine. Don't force it. But this towel sometimes allows you to get a little bit more than even this. And if that's the case, you're going to take one hand and place it on that lower leg, and you're just going to bring that heel right towards your thigh or towards your butt. Stop before it gets painful, or if it gets painful, don't go to that point on the next repetition. Hold for about 5 seconds and then repeat 9 more times.
For this next exercise, you will be seated at the edge of your chair, knees bent up to about 90 degrees and then feet on the floor. You will need a pillow for this, and you're going to take this pillow, fold it in half, and place it between your knees. You may need to move your feet a little closer together. You want your knees to remain in line with your ankles. From here, squeeze the pillow, and you should feel your inner thighs or your groin muscles contract. Hold for 3 to 5 seconds and then relax. Especially when you're squeezing, you still want to make sure that your knees remain in line with your ankles. We don't want a situation that looks like this, so you may need to alter your foot position to accommodate that. Hold for 3 to 5 seconds and then rest. I like to work these inner thigh groin muscles, especially if you have hip arthritis, because those muscles tend to become really tight. Allowing them to contract and relax can really help with that tightness. 5 to 8 repetitions can be really helpful here, especially when getting started.
All right, for this next one, we're going to work on the straightening part of that leg. Keep that same hand towel. You're going to place it underneath the ankle. So this alone actually helps to straighten that knee out a little bit. If you've got some arthritis, though, that leg still may be up like this. So these are the next steps. You're going to take a strap or a towel or a sheet, whatever you happen to have handy. That's going to go around the ball of the foot. I'm going to work on bringing this foot up towards my head, and at the same time I'm going to press that leg down. So it's press the leg down, raise the foot, or raise the foot, press leg down, doesn't matter which one you do first. But again, working on trying to straighten that knee. If you are able to help out even a little bit more, if you think about squeezing that quad muscle, that helps to straighten that leg as well. If your quad muscle is acting really good, you can go ahead and keep this position and add a little muscle strength here too at the same time. Keep that quad tight, and then you're going to lift that leg up. Don't let that knee bend. If it does, then it's not quite ready to do this. And same concept, about 10 repetitions.
For this exercise, you want to sit towards the edge of a chair. Knees are at about 90 degrees and feet are firmly planted on the floor. This is going to help to work those outside hip muscles and range of motion that tends to become tight with hip arthritis. I'm going to start with my right leg, step out to the side, and bring it back in. As you bring it back in, you're also activating the groin or the inner thigh muscles. Now the left, take it out and bring it in. If it is difficult for you to lift that foot off the carpet just like I am, you can do this in socks, and on a hardwood or tile floor, you can simply just slide your foot out as far as you can and then bring it back in. Anywhere from 10 to 20 alternating repetitions of this can be a great place to start.
Our next exercise is going to work these muscles on the side of the hip. And this is actually important for the knee and the hip. But for the knee, it really makes a difference because these muscles attach all the way down into the knee. And when they're weak, we actually tend to roll that knee in a little bit and put more pressure on the inside of the knee, which of course makes that knee even more painful. So you can still stay in your bed if you would like to, or you can get on the ground if it's comfortable. I'm going to lift my torso away from the mat or the bed so I'm not smushing. I call it smushing my cupcake. Pretend you have your favorite cupcake in there. Mine's vanilla with vanilla frosting. And then you're going to work on that leg position. So when you look down at your legs, you should see your feet, maybe a little bit of your leg. But if you can see all of your legs are way too far forward, and that means you'll use more the front of the hip than you will the side of the hip. You also want to make sure that you are rolled onto the side of the hip as much as you can. Sometimes you need to put a little bit of extra padding like a towel or a pillow there if your hip is bothering you on that side. And then from here, you can either keep that bottom leg straight or you can bend it if it's more comfortable for you, which it is for me. You're going to bring this top leg back a little bit so it's towards that heel. And then you're going to turn that foot down. Again, that activates this muscle a little bit more. And then you're just going to lift. You're not lifting really high. If for some reason, though, that foot turning down hurts, you can go ahead and keep it pointed straight. Whatever feels comfortable for your body. You'll still work those muscles. I typically have people start out with about 15 to 20, but listen to your own body. You want to do as many reps as you can to actually feel like these muscles are getting tired, but not painful. So that's kind of when you know how to stop.